Hello, my name is Rich Collins. I'm the Emergency Services Director for Sarasota County. And joining me today is our Chief Health Officer and Director of the Department of Health for Sarasota County through the State Health Department, Chuck Henry. Chuck, thanks for joining me today.
Well, thanks for having me, Rich. It's a pleasure to be here.
Chuck, let's talk a little bit about vaccines. I know there's a lot of interest in that in the community, and this morning we gave an update to the board. We started receiving vaccines on right around December 28th. So we've been in this for about almost 2 months now. Where are we at, and how have we increased the amount of vaccine in the community?
Well, we're beginning to see a lot more vaccine flow into the community. In those early weeks, we had some weeks where we only had 1,000 doses allotted. The last couple of weeks, last week we had 8,000 doses allotted, and while that was delayed a little bit due to weather, we still received it in on Friday and got it out. And this week we have 13,000 doses allotted. Those are all first doses. In addition to that, we receive a weekly allotment of second doses as those become due.
So if I'm doing the math on that, just between last week and this week, you're at over 21,000 doses, and you're working from multiple sites to get that done and partnering with a number of people. Can we talk a little bit about that?
Sure, I think that's an important point. We have our Sarasota Square Mall site. Our capacity there is about 2,000 doses a day, whether it's first or second doses. So obviously we can't get all that out through that one outlet. So we have the opportunity to partner with cities, with the state incident management team, and various other avenues to get vaccine out as rapidly as we can. It's important that these pop-up events, which is just a term we use for an event that's temporary instead of our permanent, are all being appointed right out of our countywide registration system. That's really important to us because we have over 160,000 residents over the age of 65. About 37% of those have been vaccinated, but we still have more than 100,000 to go. So we want to stick with that registration system and our commitment to the citizens to make appointments right out of that in order of registration. So the pop-up that you saw in Venice a few weeks ago, that was a partnership with the state, and the state actually brought in extra vaccine above our allotment, 3,000 doses for that, but all the appointments came right out of our county registration system. The pop-up in Venice last weekend was a huge help for us, and it was a partnership with the city of Northport and the state incident management team. Because our vaccine was delayed due to weather and we didn't receive that 8,000 until Friday, we were able to partner with them and get 3,000 of that 8,000 out starting the very next day through the weekend through that event, which is a huge help so that we can make sure that vaccine gets out as rapidly as possible.
So there's a couple things I picked up there. Obviously, we're working with local partners in the state to do that, and it's been very helpful for us. What I heard you say is all of our sites that we're dealing with are working right out of our registration system, which is first come, first serve. We're following in line. Can we talk a little bit about that? I know there's a team of people between the health department, emergency management, our IT staff, communications working on that daily to make sure that we follow that process.
There is, and the health department is very grateful that the county stood up this registration system even before the state had one available, and it's working well for us. The one issue we're having, and the public probably doesn't realize the 20 plus staff that are working 7 days a week managing this registration system, plus the communication staff that interact with citizens with questions. But a big problem we're having is citizens that have received their shot somewhere else, maybe at Publix, maybe in another county, but they're still registered with us and they leave their name there. So the way our system works, if you're registered and your number comes up, you're going to get an appointment. And you have the ability, when you receive the appointment, to decline the appointment or to opt out. And the number of declines and opt-outs has just risen dramatically over the last couple of weeks. In fact, the weekend event I mentioned in Northport, when we sent out the 3,000, tried to get 3,000 appointments set up for that, we had to send out over 5,000 appointments to get 3,000 people to accept the appointment.
That's a huge deal. So it's really important for our residents to know that if they've gotten the shot somewhere else, to please take themselves out of the system so that we can move quicker through to get to those that really need the shot. I think one of the other things that we've noticed is some of the citizens may not have completed their application. So it's really important for citizens to look at their status as well, correct? Because if it's incomplete, they may not get a call. They have to complete the registration in total in order to make sure they get that call.
That's a great point, Rich. And there has been a number of those just in the last week. Citizens have called in to say, hey, you passed my number. Why didn't I get a call? And when staff looks into it with them, we realize they never completed their application, failed to answer a few questions or whatever, and their application is still marked as incomplete. And as long as it's in an incomplete status, the system won't send them an application.
That's correct. Now, I think the other concern a lot of folks have, especially with the weather and the delay in delivery of some of the doses last week, are the second doses. So can we talk a little bit about that, about when they're contacted and where they're going to go?
Sure. The second doses, of course, we have people becoming due for their second dose every week. And I want to stress that with the Moderna vaccine, which is what we're primarily using, it's a 28-day window. So the CDC says that we should provide your second dose on or after day 28. And there's a 14-day or 2-week window from day 28 forward that's optimal to give that second dose. It doesn't have to be right on day 28. So what we've done to help our staffing and our clinic schedules is we try to, for consistency, have tried every Thursday to hold an all-day second dose clinic. We're now reaching a point where there's more second doses due than we can do in a one-day clinic. So because of the late vaccine arrival last week, we have a few more that are trying to catch up on their second doses. So our second dose clinic that we held last Thursday didn't cover as many as we want. We held another one Monday afternoon, and we'll be having another one this Thursday and possibly Saturday. We're still working on getting our staffing set up for that. So the point is, if you're due for a second dose, we have your second dose waiting for you, and you will be notified. And we try to, through communications, tell you if you received your first dose between this date and this date, you should be getting your second dose. So it's kind of a backup. If you don't get an actual appointment from us, then you'll know you should have, and you can check on that.
I think the other thing to point out is, as we're doing these pop-ups, those second doses, they're coming in, they're going to go to the same place. So if you went to Northport for your pop-up, you're going to go back to Northport, but that dose is coming through the county to them for that. And it's also important, I think, for those that went to the Venice Community Center, that was a different vaccine, so that's important, right? That's a Pfizer vaccine, so they need to go back to the Venice Community Center for that.
The operation at the Venice Community Center 2 weeks ago was the first Pfizer vaccine operation we've had in our county. If you got your first dose with Pfizer, you have to get second dose of Pfizer. I, at the County Health Department, do not have Pfizer vaccine. It's all Moderna. The state team that provided that Venice operation will be back. For Pfizer, it's 3 weeks, 21 days is when that window opens. So they told everybody that got their vaccine that they need to be back at the Venice Community Center 3 weeks from that date to get their second dose. And so we'll be working with the state to try to make sure those people show up there. If you miss your second dose on that day, then we're going to have to do some work to figure out who has Pfizer in one of our surrounding counties that might be able to help you out, because I don't have any.
So that's a great point. So where you went for your first dose is where you're going to go for your second dose in the same vaccine.
And you know, it goes beyond that. We recommend for anybody that gets their first dose somewhere else to go back to that location for their second dose. And the reason is the federal and state system is set up to send the second dose to the same place you got your first dose. That's not to say that we don't try to accommodate people that for some reason can't travel back to wherever it was. We will do our best, but we can't guarantee that because I don't get that vaccine. It goes back to the place that you got your first dose.
So if I happen to get it at Publix in DeSoto County, I need to go back to that Publix in DeSoto County.
Absolutely, especially somewhere that close. You know, that we have people that got theirs in other states and are now here, and we do try our best to accommodate them, but we may not have the vaccine if it's a different vaccine than Moderna, and I may not have the Moderna doses for second dose. Again, we try our best, but it's always best to go back to where you got your first dose if that's at all possible.
So let's look at some forward plans really quick, Chuck. What is the health department looking at for those that may be homebound, can't get out, there's no way for them to get to a vaccine site and they would like the vaccine?
That's a great question, Rich. That's one of two significant community problems we're trying to work out right now. People may have seen in the newspaper that in Venice, the Venice Fire Department's running a pilot for the state, doing some work with homebound. We at the county-wide level are also beginning to look at that, and in fact, This last week began sending flyers out through service agencies that serve those that are homebound to gauge interest in receiving the vaccine. And we're going to be setting up some systems either with the county or with home health agencies or both to go through those lists and get out and vaccinate those folks that are homebound. So that's a really important group. And again, the way we're identifying them is through the agencies that provide home services to those individual citizens.
That's great to know for those citizens. Finally, I think the governor talked the other day about increasing vaccine for teachers and others. How's that looking in future planning for us, teachers, law enforcement, those that may have medical conditions? How's that looking?
So I'm still waiting for the written guidelines on how that's going to roll out from the governor's office. He did talk about that at a press conference yesterday. He indicated potentially using the 4 new big federal sites that are going to be set up. Our closest one is in Tampa to vaccinate law enforcement and teachers, and maybe starting at those over 50. We may have some opportunities locally to assist with that, but I don't know exactly what that looks like yet. So stay tuned, and as we get that information, we'll be sharing it out.
Chuck, I really thank you for the time today. I know we covered a lot of ground and a lot of information. Hopefully that was very helpful for all our citizens. It's really important that if you'd like further information, you can go to our website, scgov.net. Look for that purple banner up at the top for the vaccine. You can click on that and get information. Or you can always call our VAX hotline, 941-861-VAX. That's 941-861-8297. Thank you so much for your time today. Please stay safe. Thank you.